So, good day, Miss Anne. By the way, I am Christine May Sabayong from BSN2. For today's video, I will be discussing and explaining the four procedure, which are the first is the newborn care, the Leopold's maneuver, the prenatal care, and the urinary catheter for the male and female. Including the importance of each procedure and the indications and the possible contraindications of this procedure. So first, I will be discussing the newborn care. So in newborn care, it consists of evaluations for the need of resuscitations, complete physical examinations, administration of prophylactic medications and vaccines, and adequate feedings, safe sleep and hygiene of the newborn, and other important areas of for the baby in well-being. So, the importance of each procedure is to aim of both the initial examinations at birth and the full neonatal examinations. It is confirmed by the normality, identifying congenital abnormalities, and include the medical concerns. So, it is also gives the midwife opportunity for the further health educations and parental reassurance. So, by the help of Apgar scores, it describes the conditions of the newborn infant that immediately after birth and when properly applied. So, it is a tool for standardized, which is the assessment that also provides a mechanisms to record of fetal to neonatal transitions. So, Apgar scores is do not predict individual mortality or adverse neurologic outcome. But, however, based on the population studies of Apgar scores is less than 5 to minutes and 10 minutes clearly that confirm an increased relative risk of cerebral palsy and the degree of abnormality that correlates with the risk of cerebral palsy. So, in most infants with the lower Apgar score, but however will not develop in cerebral palsy. But the use of Apgar score is affected by the many factors that including the gestational age, the maternal medications, the resuscitations, and cardiorespiratory and neurologic conditions. So, if the Apgar score is 5 minutes is greater than 7, is unlikely the peripartum hypoxia ischemia is caused by neonatal encephalopathy. The indications and the complications of newborn is first is the birth defects, second is the birth injury, the third is breathing problems, fourth is the drug addictions, fifth is the failure to thrive, the low birth weight, and lastly the blood sugar. So the second procedure is by Leopold's maneuver. So in this procedure is in obstetric Leopold's maneuvers are a common and systematic way to determine the positions of a fetus inside the human's uterus. So they are named after the gynecologists that they are also used an estimate term fetal weight. So the maneuvers consist of four distinct actions, each helping to determine the positions of the fetus. The maneuvers are important because they help to determine the positions and lie of the fetus, which is conjunctions with the correct assessments of the shape of the maternal pelvis. So it can indicate whether the delivery is going to be complicated or whether a cesarean section. So it's necessary that the indications and the possible contraindications that there are no known for risk for using Leopold maneuvers, which is as long as they are being performed by qualified medical professionals. But however, they are not always accurate at determining the positions or estimated weight of the baby inside the woman. So in the 36 weeks of pregnancy, so the medical provider will not likely use them before your 36 week of checkup. So your provider will likely ask you to do procedures because a full bladder can make it difficult to relay and determine your baby position with accuracy. So, but leupold maneuvers are very accurate, but it is possible that your healthcare providers will still perform an ultrasound prior to your delivery to confirm your baby's position particularly. So if they are concerned that your baby is in the transverse or bridge positions, so leupold maneuvers are difficult to perform on people who are obese because it is difficult to feel the baby's positions that they are also more complicated to perform on patients who have polydramnios, which is when you have no much amniotic fluid surrounding to your baby. So as well as people is fibroids. So the third procedure is perineal care. So the importance of perineal care is uh, uh, it is your loved ones is dignity and understand the process and why it is necessary that will go a long way to making the whole procedures less too stressful. So with a little conversations and maybe a little humor to lighten the mood, so you can help keep your love and one properly taken care of, be comfortable and healthy. So perineal care is needed mostly for those who are bedridden and dealing with incontinence or who have an end-willing catheter. So it is important to wash uh, this area properly as doing so allows you to deter the breakdown of sensitivity of the skin. So in addition, so one will be able to avoid itching, odor, burning, and infections so that the perineal massage focuses softly and stretching. So perineal preparations help you learn how to relax into the natural opening of the vagina during the childbirth and how to become accustomed to this sensation. So, the indications and the possible contraindications of perineal care in human and some other primates that the head of the term of the fetus is so large. So, in comparisons to the size of the birth is the canal that delivery that may result in some degree of trauma. So, as the head passes through the pelvis, so the soft tissues are stretched and compressed, the risk of severe tear that is greatly increased if the fetal head is oriented occiput in the posterior that face forward. So, if the mother has not given birth before or if the fetus is large, a surgical incision on the perineal skin called an uh, ephes rather that was historically used by routinely in order to reduce a perineal pierce. But however, in routine use has declined as there is some evidences that increases the severity of tears when it is not indicated. So several other techniques are used to reduce the risk of tearing, but with the little evidence for efficacy. The antenatal digital perineal massage is often advocated and may reduce the risk of trauma only in the nulliparous woman. So, hands-on techniques employed by the midwife. So, the last procedure is urinary catheter for both male and female. So, Certain women prefer standard length of catheters, such as some who are confined to the bed, those who are obese, or those who always wear trousers. This also catheters pose no safety issues in female patients. But however, in a standard catheter must be used by the with the male patients. The people who have difficulty emptying their bladder use you should use catheter, which is also a thin tube that is passed into the bladder. So usually through the urethra and allows the uterine to drain freely. So there are two main types of catheter. First is the intermittent catheter, also called nalation or in-out catheters that are inserted into the bladder temporarily, so to allow an empty and add air then remove and the wheeling catheters. Also could falsely catheters that there is designs to remain in the bladder that push continuously for longer periods of time. So the female compact catheters, which is length 7 centimeter for female, that compact size, that catheters are available, that they have been found to be as effective as long as 20 centimeter length. So catheters are also discreet for carrying. So in the male compact for catheters are available, but it's also packaging that is compact rather than the catheters, as men will almost always that require a looser length catheter. But the indications of and the possible contraindications of catheter is acute urinary retentions. Example is benign prostatic hypertrophy, blood clots, and also the chronic obstructions that causes hydronephrosis, and initiations of continuous bladder irrigations that intermittent decompressions for neurogenic bladder, hygienic care of bedridden patients. But what is the most common complications of urethral catheterizations is catheter is associated in urinary tract infections. It is the most common nosocomial infections in hospital and nursing homes. So it comprises more than 40% of all institutionally acquired infections. So these cautions are considered complicated in urinary tract infections, and a most common complication is associated with long-term catheter use. So that's all. Thank you.